12 conditions that look like ADHD. If your child is fidgety, restless, or has problems paying attention or focusing, the first thing that comes to mind is ADHD. But what if it's not ADHD? In this video I will tell you about 12 other conditions that look like ADHD. Don't forget to like this video and subscribe to the channel. Lots of children might constantly be restless and on the go. They might also be hyperactive, inattentive and have problems fitting in with their peers. It is easy to assume it's ADHD. Due to greater awareness, ADHD is more understood, accepted and frequently diagnosed. However, the typical symptoms associated with ADHD might be actually symptoms of something else. Did you know that several conditions produce similar symptoms and can mimic ADHD? ADHD is a complex issue and requires a proper and thorough diagnosis. A good assessment will influence the treatment and coping strategies, as a result, your child's well-being and success. It is crucial to properly diagnose it and rule out other conditions with similar symptoms. Usually, the ADHD diagnosis process will take several months, or longer, and will involve several specialists working together. You may easily assume that ADHD causes your child's difficulties. 1 in 10 children has ADHD, and ADHD has become more popular and better understood. To diagnose ADHD, doctors use different assessments based on the main characteristics of attention deficit disorders. These symptoms and guidance are in a go-to manual for mental health and neurological conditions called DSM-5. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, lists the symptoms. It also emphasizes that they must be ongoing, affect a person's life significantly, and other reasons for behaviors or conditions causing them have to be ruled out. Now I will tell you about 12 conditions that look like ADHD. For more information visit our website, allspecialneedsnow.com. In our blog section, you can find answers and advice on many topics, including autism, ADHD, learning difficulties. 1. Anxiety disorder. The first condition that looks like ADHD is anxiety. Many children with ADHD have anxiety disorders and are likelier to get anxiety. Your child might be anxious if they are often sad, worried, or scared. Sitting still in school and paying attention if you worry constantly is challenging. Doctors should evaluate the possibility of anxiety, not only because it mimics ADHD symptoms but also because they often occur together. 2. Depression. Another condition with symptoms resembling ADHD is depression. A child who is depressed is likely to be sad and worried. It would be challenging for them to stay calm, focused and settled. Instead, they might be fidgety, nervous or act out. 3. Autism. Autism spectrum disorder is one of the conditions that look like ADHD. Children with autism struggle in social situations most of the time. This struggle can mimic ADHD symptoms, such as children not getting along with their peers. These problems might happen for a child with ADHD because of their inhibitory control, self-control problems. For autistic individuals, problems with social interactions might have more to do with the lack of the theory of mind. Autistic people may say inappropriate things or be literal, which might look like when a child with ADHD cannot control themselves. It is also not uncommon for both of these conditions to be comorbid, which means they occur simultaneously. A thorough evaluation is very important for a good diagnosis. 4. Oppositional defiant disorder, ODD. ODD is a type of behavior disorder. Children with ODD will lose their temper and have problems obeying and following the rules. They might be uncooperative and defiant, often get in trouble or have frequent temper tantrums. These children often argue with adults, refuse to do what they are told and may often be angry and unkind. Lots of these symptoms are similar in children with ADHD. The main difference is that with ADHD, your child will also have attention, focus and hyperactivity problems. 5. Conduct disorder, CD. Conduct disorder is another type of behavior disorder similar to ODD. Like with ODD, a child with conduct disorder will be defiant to rules and standards. They will also have antisocial behavior. They may lie, steal, run away, skip school or be aggressive. They may also assault people, be cruel to animals or be violent. A child with CD might be a bully, get into fights or be involved in crime. Conduct disorder often occurs in children from disadvantaged backgrounds or with a family history of mental health and abuse. It can be confused with ADHD because children with ADHD might be fidgety and not always good with their peers. They might not know how to take turns or pay attention. However, they usually are not aggressive. 6. Learning difficulties. Learning difficulties like dyslexia, dyscalculia, dysgraphia or auditory processing disorder might cause ADHD-like symptoms. If a child struggles with reading, writing, maths or other aspects of their learning, they might have problems with attention. It may be difficult for them to concentrate, so they present problematic behaviors. 7. Bipolar disorder. Bipolar disorder is another condition that looks like ADHD. It is a mood disorder. It causes mood swings and may make a person feel extremely happy or extremely low. Bipolar disorder is caused by an imbalance of chemicals in the brain. It can be treated with medication by a psychiatrist. Bipolar disorder will cause a child to, for example, have problems with staying focused, have issues sleeping, be irritable or have aggressive outbursts. Many of these symptoms resemble ADHD. The difference, however, is that ADHD is chronic and ongoing and bipolar disorder is episodic. Children with bipolar disorder will have periods of good mood that can be interrupted by periods of depression or mania and lots of energy. 8. Sensory processing disorder, SPD. Another condition that may look like ADHD is sensory processing disorder. Sensory processing disorder is a condition that makes someone experience a greater sensitivity to how smoothly sensory information is processed. Children with SPD might have different experiences with their senses of sight, hearing, smell, touch or taste. A child with SPD might be sensory seeking or sensory avoidant. 9. Epilepsy. Epilepsy is a neurological condition that is often characterized by people experiencing seizures. One type of epilepsy, called absence seizure, may look like ADHD symptoms. It causes a child to zone out when having an episode. They may look confused and not paying attention, staring into space for a few seconds. A child with this symptom will look like a child with ADHD who is not paying attention and is unable to focus. Absence seizures may cause the child to have problems in school, just like with ADHD, because they cannot focus and concentrate on their work after briefly losing consciousness. The difference is that the child might be completely unfocused and unreachable during an absence seizure episode. In contrast, a child with ADHD can divert their attention quickly after, for example, touching them, clapping or calling their name. 10. Tourettes Syndrome, tics. Tics are rapid, sudden, and recurring movements that are usually out of control. It might be blinking, jerking, clicking fingers, sniffing, clearing throat, repeating phrases or words or even swearing. Tourette's syndrome is diagnosed in people with chronic and persistent tics that affect their life. Tics may sometimes be comorbid, coexisting, with ADHD. These sudden and uncontrolled movements may appear as fidgeting and an inability to focus. These symptoms might be mistaken for ADHD. 11. Obsessive compulsive disorder, OCD. Obsessive compulsive disorder can present in two ways, obsession and compulsion, or both together. OCD involves having unwanted, intrusive thoughts or fears. It may also characterize behaviors that are a response to anxiety and fear. It might be, for example, excessive hand cleaning, due to fear of germs, compulsive counting, checking house appliances, light switches or taps, fear of possible accident. Some of the behaviors people with OCD present may look like ADHD behaviors, being unfocused, restless or fidgety. The difference between OCD and ADHD is that OCD is internalizing disorder, and ADHD is externalizing disorder. ADHD being externalizing means that it shows itself on the outside of a person, with their behavior and actions. Internalizing disorder, like OCD, means a person is tormented by the thoughts inside them. 12. Being gifted. And the last condition that looks like ADHD is being gifted. Gifted children can sometimes be mistaken for having ADHD. It is because they are intelligent and clever and might be ahead of their peers in academic achievement. It may make them feel bored, not challenged enough and frustrated. It can cause them to react with behavior like fidgeting, because they are bored, or lashing out, because they are misunderstood, or they might challenge adults who work with them. Very often, gifted children experience asynchronous development. It is when someone has significant strengths in one area but deficits in another. Gifted children may lack skills in some areas of their lives, for example, social skills. It can cause frustration and present problems similar to ADHD symptoms. Do you know any conditions that look like ADHD that I haven't mentioned here? Let me know in the comments. Thank you for watching. Don't forget to like and subscribe to the channel. Visit our website, allspecialneedsnow.com.